So Nadine Tung presented results on behalf of a study conducted within the Translational Breast Cancer Research Consortium of the PARP inhibitor olaparib, really extending its use beyond the traditional FDA-approved indication of germline BRCA1 or 2 associated metastatic breast cancer. So this study actually enrolled two cohorts of patients. The first were patients who had germline alterations in other genes that predispose to breast cancer. So for example, PALB2 or CHEK2. And then the other cohort enrolled patients with somatic alterations in DNA repair genes, and that was inclusive of BRCA1 and 2. And so patients received single agent olaparib. And what was very interesting is that in the germline patients, there were patients with PALB2 mutations, and in that subset, which was I think about half of the patients enrolled in that subset in that cohort, there was an 80% objective response rate, which is remarkable, I think, and very interesting, whereas there were not responses seen in patients with germline CHEK2 mutations. On the other hand, in the patients with somatic alterations, the largest proportion of those patients were those with somatic BRCA1 and 2 mutations, so patients who are germline BRCA1 and 2 negative, who have a somatic BRCA1 and 2 alteration acquired in their tumor. And for those patients, the response rate was about 50%, mirroring what is seen in germline BRCA carriers. So I think these data are really provocative and very interesting. I think they certainly support the current NCCN guidelines, which is that patients with metastatic breast cancer should in general be offered germline genetic testing, both for their own medical care as well as that of family members. And I think that points to a potential additional role of somatic tumor testing in patients with metastatic breast cancer. Obviously, this is a small study. It's not a randomized study. I think a randomized study is very unlikely to ever be done in this setting, given the rarity of the patient population. But certainly is very provocative data, and I think very interesting and welcome data.